All right, so the next diagnostic modality, like if you want to confirm that there's any problem with the heart and all the stuff, right? Another way of doing this is what is known as a transesophageal echocardiography. Now, when they say something is trans, what do they mean? That means you are passing through. So they say transesophageal. So that means you are trying to access the heart by passing through the esophagus. Do you understand? So we'll be discussing this modality. You see, this is it. You put it through the esophagus. Come here. Then you now make very clear images of the heart. Okay. So for the transesophageal echocardiography, we'll be defining it, talk about the indications, when you need to use this type of modality, talk about the advantages. We'll talk about the procedure, how to do it. We'll talk about the risk factors involved in this. Then finally, we'll look at the complications. Not finally, all right? Benefits. Benefits is the last thing that we're looking at. All right? So for the definition, we say that the transesophageal echocardiography, also known as what TEF, is a diagnostic test that uses what high frequency sound waves to produce detailed images of the heart and its blood vessels, right? So you are trying to what? Visualize the heart. So you put it through the esophagus down here, and can you see the transducer? Then you can now snap the heart. Not really snap, you can just view it real time on the screen, okay? And all that. Alright. So a probe is actually inserted through the mouth. A probe is inserted through the mouth or the nose. Alright. It passes through the esophagus. That's why it's actually derived the name transesophageal. Alright. So now as it passes through the esophagus down, you can now be able to capture images behind the heart. Okay. Indications. When should you do this transesophageal echocardiography? If you want to evaluate the heart valves and functions of the heart, if you want to dictate if there's any blood clot or tumors in the heart, if you want to access for cardiac chamber and walls, you want to basically look at the cardiac chamber and walls to see if it is still intact, you can do this transesophageal echocardiography. Then guidance during cardiac procedures like ablation, device placement and all the stuff, right? Then if you want to also monitor for what cardiac function during surgery, you can do this. Advantages of this method, this transesophageal echocardiography. If you do it, there's a guarantee of you having very high resolution images. So whatever you are trying to look for around the heart, you find it. All right. It is a minimal invasive procedure. You are not opening up the patient, so it's minimally invasive. There's a real-time imaging. So as you actually brought the probe here, as you are moving it, you are seeing it real time on the screen moving too. All right. So there's a real-time imaging. It can be performed at the bedside or in the operation room. It is useful for patients with what difficult acoustic windows. All right. Procedure. The patient is given mild sedation or topical anesthesia, just anything that can just make them sleep or just relieve pain for a while. Okay. Next, the probe will be inserted through the mouth or nose and be guided down the esophagus. Next, images are captured and displayed on the monitor like this. Right. The probe is removed after the procedure. Risks and complication. It can result to gagging or discomfort during probe insertion. The patient will not be comfortable, of course. Something is going into your mouth and it's not part of you, okay? It could lead to bleeding or perforation of the esophagus. It could lead to dental damage. It could lead to reaction to sedation or anesthesia that was actually initially given. All right, so I think this is it for what? Transesophageal echocardiography. Definition, indications, advantage, procedures, risks, and everything.